Well, good afternoon. I'm here today virtually with Minister Copping and Dr. Dina Hinshaw to provide an update on COVID-19 and to announce a further expansion of booster doses, availability of rapid test kits, and some targeted health measures to help protect Albertans and our healthcare system from the highly transmissible Omicron variant. Since I stood in front of you about a week ago, the situation in our province has continued to evolve, underscoring the importance of continued efforts by Albertans to protect themselves and the health system from the Omicron variant that is moving rapidly all around the world. Our active cases have gone from about 4,000 on December 14th to 6,000 yesterday. Our positivity rate, which has been at or below 3% for most of the month, has begun to climb in recent days and is now at 11%. We've also seen a rise in the number of confirmed Omicron cases in the province, and the proportion of total cases identified as the new variant is growing quickly. Between the 3rd and 9th of December, it represented just 1% of all cases. Between the 10th and 16th of December, about 22% of all new cases in Alberta were Omicron. And between December 16th and 18th, Omicron represented roughly 52% of all cases. Now, as I said last week, there are still many unknowns about this variant, and we continue to very closely study the emerging data around the world. But what we do know is that this variant is more transmissible than any previous strain of the COVID-19 virus. That is why we've already taken steps to protect Albertans, including expanding the eligibility of booster doses to all healthcare workers and everyone 50 years of age and older, as well as making more than 2.5 million rapid tests available for free across the province. Altogether, we've distributed since the beginning over 8.5 million rapid tests. But more must be done urgently to protect our healthcare system from the potential threat of Omicron. First, as announced this morning, we've opened up booster doses to anyone 18 years of age or older who had their second dose at least 5 months ago. Now, let me be clear. Getting a booster dose is the single most important thing that you can do. So if it's been at least 5 months since your last dose, book your booster right now. While we were originally aiming for the 6-month interval to provide longer-term protection, we are making the strategic decision to move up these doses to protect Albertans urgently, given the rapid spread of Omicron. This comes at the recommendation of our Chief Medical Officer of Health as evidence becomes available about the potential for reinfection in those who have had previous strains of COVID and breakthrough infections in those vaccinated with 1 or 2 doses. Whether you were previously infected with COVID-19 or you've had 0, 1, or 2 previous doses, we're urging every Albertan to get whatever vaccine they're eligible for as soon as they possibly can. This will help to keep you and those you love safe. It'll also help to protect our hospitals from being overstressed again. And we are going to move heaven and earth to get as many booster shots to Albertans as possible. We'll be expanding the number of sites available to administer vaccines across the province and working with both local community groups and large employers to make boosters as convenient as possible. So let me be absolutely clear. There's a lot we still do not know about Omicron. We know it spreads quickly, but we do know that booster shots are a very effective way of protecting people from infection and, we believe, from severe outcomes. So to date, we have only 16% of Albertans who had received 2 doses who have gone on to receive their 3rd shot, their booster dose. With the opening up of eligibility today, all but 11% of those who've received second doses are eligible, have had a second dose 5 months or more before now. So please come forward. It just take a bit of time, book it, go to the AHS booking tool or visit a local pharmacy that is administering vaccines. Getting that 3rd shot is the most effective thing that you can do to protect yourself and in turn your loved ones and our hospitals. Now, in addition to booster dose appointments, we're also doing everything we can to get more free rapid tests into the hands of Albertans as an additional tool for protection. There's been a tremendous response since we made testing kits available at pharmacies and Alberta Health Services sites across the province last Friday. We know that there is more demand than supply at this moment, but I can assure Albertans that we're doing everything we can to get more kits into people's hands as quickly as possible. First, we continue to push the federal government to send us more test kits and to accelerate approval of more rapid test options, particularly easy-to-use options, in order to increase the overall availability and supply here in Canada. But we're not only relying on Ottawa to get us the rapid tests that we believe Albertans want and need. We're moving ahead immediately with the private procurement as a province of 10 million rapid tests, which we hope to make available to Albertans in early January. In addition to expanding eligibility for booster doses and procuring millions of rapid tests for Albertans, Minister Copping will speak to some additional targeted public health measures that we are taking to help slow the rapid spread of Omicron. These are largely focused at avoiding super spreader events by reducing contacts in large settings like major events, large capacity venues, and certain discretionary activities where there is a high risk of transmission. While these changes look at reducing contacts in large settings, it's important to remember that small everyday actions can have an important impact as well. And that is why we are appealing to Albertans to reduce their number of daily in-person contacts by half over the coming weeks. These new measures in large public settings will help, but we also need Albertans to make personal choices in their daily lives that will slow transmission. These measures are in addition to the public health measures already in place, including the restriction exemption program, capacity limits for retail businesses and places of worship, weddings and funerals, and indoor social events, as well as the requirement to work from home and many more provisions. We encourage Albertans to go to the Alberta Health website to update yourself on the various public health measures that are already in place. I know this is challenging news to hear just before Christmas and as we head into the new year, but it is necessary given what we know and what we are still learning about the Omicron variant. We need to take what we've learned from previous waves of the pandemic and apply it to our current situation. This will help limit the impact on the health and well-being of Albertans and our healthcare system. So please do the right things. Get a booster shot, use rapid testing where appropriate, follow the public health measures and guidelines that have been implemented, and try to reduce your social contacts this holiday season. I'll now turn the podium over to Minister Copping for further details.
Thank you, Premier, and good afternoon, everyone. Our number one goal throughout the pandemic has been, and continues to be, limiting the number of Albertans who become severely ill from COVID-19. That's why we're expanding boosters, making rapid tests available, and continuing to take a balanced approach to public health measures. We know that Albertans need health care for more than just COVID, and that's why we're taking the steps necessary to ensure our healthcare system will remain available to everyone who needs it. We know that with the emergence of Omicron in the province, there's the potential for our healthcare system to once again be severely stressed. That's why, as announced last week, my ministry is working with AHS on plans to restore ICU surge capacity if needed. We currently have 228 ICU beds, which is already above the normal capacity of 173. And we're working with AHS to be able to quickly ramp back up to 380 ICU beds should they be needed. But let me be clear, I hope they won't be needed. We are taking action to avoid it, and we're asking Albertans to help avoid it. But we need to be prepared. We're also working hard to minimize disruption of surgery and other services. But ultimately, our ability to keep these services available depends on all of us following the public health measures that are in place. While we're still learning about Omicron and its severity, we want to be sure that we have all the bases covered. What we do know is that evidence is showing that a third dose of COVID-19 vaccine provides better protection against the variant than 2 doses. That's why, as the Premier said, we've expanded availability of booster doses to all Albertans age 18 and older, starting 5 months from your second dose. We're shortening the interval for a simple reason: to give more Albertans a third dose sooner. And with this new interval, about 3/4 of Albertans who've received 2 doses will be eligible for a booster dose by the end of December. And as of today, that works out to an additional 1.55 million people who can now get a third dose. And the sooner that Albertans receive a third dose, the better protected they will be against severe outcomes due to COVID-19, helping to prevent potential hospitalizations. They will also be protecting those around them, as a third dose further reduces the chance of infection with Omicron. Albertans can book their booster with participating pharmacies and AHS facilities, either online at alberta.ca or by dialing 811. In addition, we're working hard to expand our rapid testing program, which provides an extra layer of protection. It will help identify more COVID cases sooner, particularly among people who don't have symptoms, so they can isolate and reduce the risk of spread, that they'll spread the virus to others. So if you have a positive result on a rapid test, you must isolate. And we ask that you book a PCR test through AHS right away to confirm the result. A reminder, if you have symptoms, you must isolate regardless. I'm pleased to report we've already made more than 500 rapid test kits available, each containing 5 tests, to Albertans over 700 pharmacies and AHS centres in 104 communities across the province. And I want to thank all Albertans who have taken the time to get a kit. I appreciate that some people are frustrated that some locations ran out of supply, but I'd like to say 2 things. First, there was a big rush at the very start because people are excited about the test, and that's a good thing. And second, and more importantly, more tests are on the way. The initial distribution was 2.5 million tests. 2 million are on their way out the door right now, and we have firm commitments on delivery of another 1 million tests later this month. And we've requested another 4 million plus tests. We continue to press the federal government for more supply, but we just can't leave it to Ottawa. We need more tests, and we need them sooner. So we're going to buy our own, as indicated by the Premier. We're looking at procuring up to 10 million rapid tests for delivery in January. That's 4 times the supply we distributed last week. So if you haven't picked up a kit yet and you want one, please visit alberta.ca/COVID rapid tests to find the location nearest you, as many locations still have supply available. Rapid tests can be used ahead of gatherings and events to help identify additional COVID-19 cases. Now, a negative test does not mean you're guaranteed not to have COVID, so please don't use a rapid test as a reason to take extra risk and continue to follow the rules. But they are a good tool. They give each of us a new way to help reduce the spread of COVID-19. They'll help because Albertans will use them the way that they're intended, the same way they've done the right thing overwhelmingly right from the start of the pandemic. Now, unfortunately, Omicron has made it necessary for us to make a few more changes to reduce contacts and slow the spread of the virus. Businesses participating in the restrictions exemption program have done an excellent job of following the rules and allowing vaccinated Albertans to continue accessing their services. However, due to the risk of breakthrough infections, we need to make some adjustments. Venues above 1,000-person capacity are now limited to 50% of this capacity. Venues with a capacity of between 500 and 1,000 are capped at 500. Consuming food and drinks is not permitted in seated audience situations in large venues or during intermission to ensure masks are continuing to be worn throughout. With the increased transmission risk of Omicron, it's important that the overall numbers of people mixing in venues be limited and that attendees remain masked at all times. As the Premier said, we need to avoid super spreader events. This change will apply, for example, to NHL games, as well as the World Junior Tournament set to begin on Boxing Day. Restaurant and bars participating in the REP are limited to 10 people per table, and no recreational activities such as dancing or billiards will be permitted. These changes will take effect at 12:01 a.m. Friday, December the 24th. We will also be requiring all businesses participating in the restrictions exemption program to cease alcohol service at 11 p.m. and close by 12:30 a.m. To be clear, those not participating in the REP are not permitted to offer indoor dining at any time. On top of these measures, we ask Albertans to take a close look at their plans and consider how they can reduce their interactions. While we will have many measures in place, such as gathering restrictions, maskings, and staying home while unwell, please consider limiting your social contact over the holidays by at least 50%. Look at going to one family dinner instead of two. And in alignment with the current work from home order, we strongly encourage workplaces to cancel any holiday social gatherings, even if they're in a venue that's participating in the REP. Before going out to any location, make sure you're following current masking guidance and wear a medical mask where possible. I know these changes to the REP can be challenging for all of us, particularly businesses who have been asked time and time again to help protect their communities. And I know all of these measures bear an extra weight during the holiday season when we want to gather with family and friends. I encourage all Albertans to keep their contact with others limited this holiday season. I know it can be difficult to adapt your plans, but I thank you for being flexible. And I'd like to thank Albertans who have continued to adapt and adhere to the public health measures. You're helping to protect not only yourselves, but your family and loved ones, and as well helping to protect our healthcare system. I encourage you to continue to do your part to keep yourself and everyone you love safe this holiday season. Thank you, and Dr. Hinshaw will now provide today's COVID-19 update.
Thank you, Minister, and good afternoon, everyone. Over the last 24 hours, we identified 786 new cases of COVID-19 and completed about 7,300 tests. As the Premier mentioned, our positivity rate is rising fast. Our Omicron cases also continue to rise, with a total of 1,609 cases now identified in Alberta since our first case. Omicron is highly transmissible, with data here and around the world showing that case counts of this variant are doubling every 2 to 3 days. Omicron is now our dominant strain, and there is increasing community transmission in the province. This means if someone tests positive for COVID-19, they should assume they have the Omicron variant. Given the rapidly increasing volumes of Omicron cases, we have redirected all our contact tracing capacity to high-risk settings at this point. As of last weekend, all new cases not linked to settings like continuing care, acute care, and other congregate sites have been asked to notify their own contacts. This is something that all provinces with rapidly increasing Omicron cases have moved to in order to focus resources on places that have the highest risk of severe outcomes from transmission. There are currently 329 people being treated for COVID-19 in hospital, including 69 in the ICU. Sadly, 2 new deaths have been reported to Alberta Health over the last 24 hours. While losing a loved one is never easy, it can be especially difficult to lose someone during the holiday season. My thoughts are with all who have lost someone, whether to COVID or any other cause. Last week, I talked about what we knew about the Omicron variant and why it was important for us to take it seriously. I want to reiterate that message today. In every jurisdiction around the world that has been able to measure the spread of Omicron, it has spread faster and farther than any variant we have ever seen. We're starting to see that same pattern begin in Alberta. I know that facing a new variant right as the holidays begin, after 2 years of constant change, uncertainty, and sacrifice, is almost unbearable. To think about having to change holiday plans last minute, especially after having no gatherings last year, is unfair. And if we could negotiate with this virus, this would be the time to say an absolute no. Unfortunately, there is no negotiating with a virus. All we can do is learn as fast as possible and make adjustments to respond to what we learn. Let me reiterate what we know about Omicron right now. First of all, it is more infectious than any other variant to date. It's breaking through immune protection both from previous disease and from those who have 2 doses of vaccine. We know that 2 doses of vaccine still provide good protection from severe outcomes, but 3 doses are even better and also boost protection against infection. This is why it is so critical that everyone get all doses of vaccine they are eligible for as soon as possible. the decision to shorten the interval between second doses and the booster to just 5 months is the best one for the situation we find ourselves in right now. While there's likely a small trade-off in terms of long-term protection by providing booster doses before the 6-month interval, there is greater benefit to the individual and collective good by administering them now while we see the Omicron variant begin to rise. The second thing that seems so clear from the current evidence is that part of the reason that Omicron is more transmissible is because long-range transmission is happening more often through aerosol dispersion. This was happening before with previous variants in specific settings, crowded, poorly ventilated indoor spaces, especially with activities like exercise, loud talking, or singing that generate more infectious particles. However, with Omicron, this is being amplified. Using high-quality masks that fit well is critically important. Our masking guidance was updated recently, and the summary is that those with risk factors for severe outcomes are strongly recommended to wear medical masks whenever they're in settings with those outside their own household. Using N95 masks is also an option. However, it is important to remember that a well-fitting medical mask provides significant benefit, and any single layer of protection that we put in place is not enough by itself. Cloth masks still also provide some benefit as long as they are well-fitting and have multiple layers, with at least one of those layers providing good filtration. Whatever type of mask you choose to wear, make sure it fits very well and use all other layers of protection possible, including staying distanced, avoiding crowded places, maximizing ventilation, and reducing the amount of time you spend in any setting outside your home. The third thing that we know is that it is too soon to have conclusive evidence of severity of the Omicron variant. In places that have had Omicron circulating for longer than we have, some have reported a decreased severity risk and others have not. In all places where Omicron is circulating, hospitalizations and ICU numbers rose several weeks after cases began to rise. It is not clear at a population level what any possible changes in severity will mean for the health system, as it's likely that those other places have not yet seen the peak of health system capacity impact. In Alberta, it has only been just 3 weeks since cases of the Omicron variant were first identified, and it is far too soon to be able to assess severity. We will learn more as time goes on, but now is the time to be cautious. As I said earlier, any positive case should be assumed to be Omicron, and cases will not receive a second notification to let them know of an Omicron result. Anyone who is feeling sick must stay home and away from others. This is a legal requirement and more important now than ever. In general, reducing contact with others is one of the most important actions we can take in addition to vaccination to help protect the health of others in our community. Throughout the pandemic, we have seen the difference we can make in fighting the virus when we each choose to reduce the number of people we come in contact with. It's critical that all of us reduce our contacts by at least half in our day-to-day routines right now while we deal with the Omicron challenge. We've posted an article on alberta.ca with tips on celebrating the holiday season safely. The recommendations include keeping in-person attendance as low as possible and talking to all guests beforehand about the options for a gathering to ensure everyone is comfortable. Whether you're a host or a guest, I encourage having these conversations sooner rather than later to help make planning easier. I want to be clear that I believe this situation is so serious that my family has canceled our holiday plans. In the next few weeks, we will see transmission rise to heights we have never seen before. We don't know what that will do to our healthcare system. If you are debating what to do with a gathering, I advise taking the most cautious approach possible. Move to having an outdoor bonfire instead of gathering indoors, have virtual gatherings instead of in-person ones, plan for Christmas in July, and celebrate right now with just your household. I know that this is the last thing any of us want to hear right now, and I know there are serious mental health implications of isolation. For those who are struggling right now, please reach out for help. You are not alone. In some cases, it will be important to gather in person to support those who are struggling, and we all need to factor that into our decisions. The bottom line, though, is that we are facing a significant and unknown threat. The next few weeks will be critical in determining what the new year will look like. Please reduce your in-person contacts. Find other ways to connect with and support those you care about. Make choices about activities thinking about the impact on those around you. And please do as much as possible to limit the opportunities COVID-19 and the Omicron variant have to spread in our communities. Thank you, and we're happy to take questions.
Thank you. That concludes the speaking portion. We'll now move to the media Q&A. There's quite a few of you in the queue, so I ask that you just keep your questions fairly tight. We do have one on the floor in Calgary, so we'll start there and then we'll move to the phones.
It's Tyson Fleur with CTV here in Calgary. Minister Copping, this one is for you, and sorry, this is not in regards to Omicron, but Calgary Police told us today that they responded to an incident here in downtown Calgary just over the weekend. They had to transport a critically injured patient to hospital in the back of a cop car. EMS was about 30 minutes out. Why is this happening? Should this be happening? And what are you doing to fix response times?
Yeah. Thanks for the question. As chatted earlier, the EMS, we understand that the caseload has actually increased by 30% since August. We have done a number of things to date to actually try to manage that. So additional $8 million to be able to stabilize the workforce. We've hired over 200 people over the last couple of years. We're engaging in terms of reviewing how do we do scheduling and better practices of scheduling to be able to increase the availability. In addition, looking forward, we're looking at a overall strategic plan to how to manage this, whether we have new resources and then a process review in terms of are there things that we can actually change in terms of how we manage EMS coming into in the hospitals, a handoff, so we can have them. So I fully appreciate and that the system is challenged right now. We know that it's challenged. We are working on it to be able to address those challenges.
Should Calgary Police be doing this type of work? And they're of course not trained to do so. And some have said that you need to make a change with EMS leadership in this province. Is that something you'd even consider?
So we're focusing on fixing the problem right now. I thank the CPS officers who actually, who did that at that point in time. We understand there is an issue, and we are going to fix it.
Thank you. With that, we'll move to the phones. Operator, can you please put through the first caller?
Kelly Kreiderman, Globe and Mail. Hi there. Thank you for taking my question. I'm wondering, moving to asking Albertans to limit their interactions by 50%, is that too nebulous to actually get anybody to take any action? Do you need something firm in terms of health restrictions?
Well, excuse me, I'm sorry, Kelly. I'll start with that, and then if Jason or Dr. Hinshaw would like to add, they're more than welcome to. So, as you know, we already have very robust public health measures in place that have been in place since early September. And on top of that, we do have nearly 90% of the adult population with at least a first dose of vaccination coverage, 85% with a second dose, and a growing number with booster shots. That does add important protection. We are adding additional public health measures today, particularly focused on larger gatherings. And I just think it's helpful to be straight up with Albertans about what they need to do in their own lives to help us to mitigate the spread of Omicron. I mean, this thing moves so quickly, as we've seen around the world, that it is clearly well established already in Alberta, and that's a very real challenge that we are facing. But we're asking people to take a look at their own patterns of social activity and work activity where they can to reduce interaction with others. So I think it's helpful just to give people those parameters. I'll tell you what that means practically in my position. We're moving all of our, for example, cabinet meetings to online instead of in person. I know of Christmas parties that I was invited to that have been canceled. I saw the other day at Rogers Place, I wasn't there, but I saw the Oilers game on TV a few days ago, and apparently a third of the ticket holders did not come to the game. So these are people already changing their patterns of behavior intuitively. We're giving folks some clear parameters here about what they need to do to help us to mitigate the spread, and I trust Albertans will, in the vast majority of cases, make good choices.
Do you have a follow-up, Kelly?
Do you think it's going to be enough do you think you're going to be having to have a news conference a week from now between Christmas and New Year's where the health restrictions and the bar will move once again?
Well, we are doing what we think is necessary based on the information that we have right now, but we are always ready to take more action should it be necessary to protect the healthcare system. I think in the next 1 to 2 weeks, we are going to start to see, I think, important data emerging from jurisdictions like South Africa, Denmark, the United Kingdom, and some others, which are ahead of us on the Omicron curve, and we'll be able to draw clearer inferences about what this variant represents in terms of severe outcomes and hospitalizations. Right now, we continue to be in a position of uncertainty. That's why we are proceeding with caution, and we ask all Albertans to do the same.
Thank you, Premier. Operator, can you please put through the next caller?
Bill Kaufman, Post Media.
Yes, Mr. Premier, I know that you relaxed some of the measures regarding social gatherings recently. One of them was doing away with the vaccination requirement. Do you think that was premature, given what's happening now?
No, and I would point out that where we are at in terms of our restriction for indoor social gathering is broadly similar to the rest of the country. In fact, most other provinces have increased stringency, increased restrictions on indoor social activity to match where Alberta already was as of last week. So in BC, it's 10 people. In the Saskatchewan has no restrictions. In Manitoba, it's one household plus 10 people, so that could be, I suppose, upwards of 20. Ontario, it's 10 people, same as in Quebec, Nova Scotia, New Brunswick, and PEI. Newfoundland, it's 25 people, so we allow for 10 adults. With respect to the unvaccinated, we were in I think, a really difficult situation where we were saying even if you were unvaccinated because you had a totally legitimate medical reason and a doctor-approved medical exemption from vaccination, under the previous rule, you were not allowed to see anybody indoors. You weren't allowed to have a single person over to your house over Christmas or to visit. Imagine a isolated grandparent, a widow or widower who I know the case of somebody who recovering from cancer, advised not to take the vaccine, has a medical exemption, and that widow in her 80s would have been unable to see a single person over the holidays. I think that was frankly unreasonable. And so that one change, I think, reflects the practice. There's only one province now that has a bar on indoor socializing for people who are unvaccinated. And quite frankly, Bill, I think that the folks who are unvaccinated by choice as opposed to medical reasons were, by definition, the least likely to observe public health measures in any event. So I think what we did there is more realistic, and where we're at now broadly reflects the policy setting across the country.
Do you have a follow-up, Bill?
Yes, I do. We're seeing other provinces just today announcing, much tighter restrictions on businesses, and obviously we're not really doing that here. Do you think these other provinces are practicing overkill?
Each province is going to make its own decisions based on the situation that they are facing. I would note that the 7-day average of cases per capita is 3 times higher in Quebec than it is here. Now, having said that, I fully expect that we are going to see rapid growth of Omicron. As you know, we've gone from a positivity rate in the range of 4% to 11% today. We should all be very concerned about that. That's why we are announcing these measures. But most importantly, let's keep our eye on the target here. The single most important thing, it's not shutting down society. The single most important thing is getting vaccinated, especially for people who have 2 shots, coming forward and getting that booster shot. So if today's announcement is a bit of a wake-up call for folks about the potential threat of Omicron to human life and to our healthcare system, then the best way they can respond to that wake-up call is by stepping forward to getting that 3rd shot. I know for many people it's kind of probably a nuisance and an annoyance, and people are saying, when will this ever end, and how many shots will there be? Here's what we know. We know that 2 shots of Pfizer, we don't yet have the data on Moderna, but 2 shots of Pfizer is much less effective than 3 shots when it comes to preventing infection from Omicron. We don't yet know how, on a widespread population basis, infection can be it can pose a threat to the healthcare system. So please step up, get that booster shot, and you'll give yourself the best protection you can have to weather the storm of whatever's coming at us.
Thank you. Operator, can you please put through the next caller?
Adam McVicker, Global News.
Hi there. Thanks for taking my question. I'm wondering if there was any options that could have taken place earlier, as I'm sure many Albertans are, really feeling, hearing about new measures coming down. Many businesses feeling in some sort of way about new measures coming down. Just wondering if there was any options for restrictions or any of these measures sooner in the month as Omicron started to rise here.
Well, we are starting to see significant spread of Omicron. We're responding to that with these measures. But I would remind you that and we had stricter measures than the rest of Canada already in place through all of December, November and October as a legacy of our response to the Delta 4th wave. So we already had more stringent public health measures in place. And that 4th wave happened in large part because we in Saskatchewan were under-vaccinated compared to the rest of Canada. The good news there is we have largely caught up. We're now, instead of like 10 points behind the Canadian average vaccination rate, we're only a couple of points behind. So we've made up a lot of ground. Now we need to move forward on the booster shots. That's the single biggest message I want to convey here today, the importance of those booster shots. So every province right now obviously has been adjusting their public health measures, many of them to come in line with where Alberta has been for the past couple of months.
Do you have a follow-up, Adam?
And so British Columbia announced some measures earlier today as well, and they set a date of January, I believe, 18th for the end. So is there a metric perhaps to provide certainty for some of these businesses that you guys are keeping an eye on in terms of these new health measures to try to limit the spread?
We don't have a specific metric. We're still early in the Omicron wave around the world. I am hopeful that over the next couple of weeks, we will start to get some more definitive data from jurisdictions that were hit early by Omicron. Like I mentioned, for example, South Africa, Denmark, the United Kingdom, and a couple of other European countries. And we should have a much clearer picture by the first week of January about what kind of threat Omicron poses to the population and to the healthcare system. And that will be able to inform our decisions throughout the winter. But where we stand right now, we think these measures are necessary right now. We'll continue to monitor the situation very closely, of course.
Thank you. Operator, can you put through the next caller?
Tyler Dawson, National Post.
Hi, thanks for taking my question. Just wanted to ask, this might be a foolish question because it'll maybe be answered once the sort of regulations come out, but I didn't hear any mention today of things like gyms or swimming pools or funerals or weddings, that sort of thing. Where do those activities and gatherings fall in these new restrictions coming in on Christmas Eve?
Sure. So the current restrictions would apply in the future unless we have enumerated a specific change in the news release. There will be a more detailed order coming forward from the Chief Medical Officer detailing the specifics around the measures that have been summarized by Minister Copping. So with respect to weddings and funerals, for example, the current attendance limit is, I believe it's 50 for those events. The same rules would apply to swimming and other gyms and other physical exercises. Those venues have to participate in the restriction exemption program. And I don't know if Minister Copping or perhaps Dr. Hinshaw would like to add any additional detail.
Covers it, Premier. We already have measures in place for funerals and weddings. That's been since the fourth wave, and the restriction exemption program applies to a number of locations, and that's been further measures have been added on by certain other jurisdictions within the province, like the cities. So those measures will continue to be in place. as Premier already mentioned, we made some very minor changes, but the legacy from the fourth wave, all of the restrictions we had in place, large with some minor changes, have continued straight through till now, and these measures we're announcing today are adding to them.
I suppose one small difference for weddings would be that effective December 24, if they are holding the reception at a licensed venue that's participating in the REP, we're asking now that we're requiring that the bar be closed at 11 p.m. So that is to limit late night socializing, which often leads to occasions where there's greater chances for viral transmission. I would note, as Dr. Hinshaw has informed me, that when we last had reduced the time for cutting off alcohol service at licensed facilities, that EMS reported a significant reduction in late-night emergency calls. So this may also help indirectly to abate some of the pressure that we've seen following the 30% increase in EMS calls that we've been experiencing since August.
Do you have a follow-up, Tyler?
Yeah, kind of unrelated actually, and probably for Dr. Hinshaw. You've mentioned masks and people wearing, better masks. There's still a good number of people out there who are wearing those sort of weird plastic chin things that aren't really masks, and lots of people wearing bandanas and stuff like that. I mean, is there any thought to putting in actual rules around what sort of masks people are wearing? And if not, what do you say to these people?
So we do have requirements in high-risk settings, such as continuing care and acute care. People must wear a medical mask at a minimum to be able to enter into those settings. And so again, there are some specific settings where we do have strict requirements. What I would say to those who are wearing, for example, a bandana or a single layer cloth mask, that those are not effective. In order to be effective, a cloth mask must have at least 3 layers, with 1 layer as a good filtration mechanism. And any type of mask that's worn must have a good fit around the face. So whether somebody has a cloth mask, a medical mask, or an N95, if it's worn slightly below the nose, it won't be effective. So again, I think it's really important that people know that the mask mandate is critical right now, that masks, the higher the quality, the better, and that they must cover the nose and mouth with a good fit for it to be effective.
Thank you. Operator, can you please put through the next caller?
Wallace Snowden, CBC.
Hi there. Thanks for taking my question. New modeling from the BC Modeling Group suggests that daily case counts in Alberta could surpass the 6,000 mark by the end of the year. The projections also indicate that the first week of the year, hospital demands could be 4 times larger than we experienced at the peak of the Delta wave. And experts behind this report say even firm public health restrictions may not be enough to avoid this spike. How would you respond?
Dr. Hinshaw, please go first.
I would say that models give us a sense of the possible future, and I would say that we should be very concerned about the future with Omicron, because what modeling across the country is telling us is that unless the severity with Omicron is drastically reduced, the impact on our acute care system could be significant. So it is absolutely critical that people take this seriously, and that all of us do everything in our power to minimize the number of people we're in contact with, because while we don't know what the severity impact will be, the number of people who are getting infected right now is larger than anything we've ever seen. And this is the time to take very seriously the need to cut down our number of in-person contacts.
And I would just add that that's why we're emphasizing the importance of people coming forward to get vaccinated, to get booster shots if they're eligible. That's the single most effective thing they can do to protect themselves, because clearly with the contagiousness of this variant, it is going to touch a huge number of people, not just here, but right around the world. And there is a tool that we have at our disposal to help protect us and, in turn, the healthcare system. My understanding is that the early data would suggest that a third Pfizer dose, a booster shot from Pfizer, helps to reduce the chance of infection by something like 75%. And what we may be seeing in other jurisdictions that are reporting relatively mild outcomes may have nothing to do intrinsically with the variant, but rather with the higher levels of population protection through either vaccination or prior infections. So get yourself protected. Get that third shot. That's the most powerful thing people can do as an individual choice to protect themselves from this variant.
Do you have a follow-up, Wallace?
Sure. I mean, I know there's lots of variables, of course, but how does Alberta's own modeling align with these projections? Is there any sense right now of when we will reach the peak of this?
I'm sorry, Dr. Hinshaw?
Alberta's modeling is in line with the modeling that's been done in other jurisdictions. We've looked at the Ontario models, the BC models, and essentially, because what we don't know is the severity right now, what the range is really looking at possible futures. So what could the future look like at different levels of severity? But it's very clear that Omicron will be a variant that spreads faster and farther than anything we've seen before. And it's also clear that we would need to have a drastically reduced severity in order to not have a significant impact on the acute care system. So I want to reiterate, now is the time to take this seriously and take action. And that it's very, very important to recognize that just because there's uncertainty, and again, that there could be some mild reduction in severity, this uncertainty actually should make us be more cautious right now.
Thank you. Operator, can you please put through the next caller?
Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. I'm wondering if there's any consideration to changing the isolation and quarantine protocols around healthcare workers.
Well, I'll invite Minister Copping, to respond, because yes, we have asked AHS to look at that, because that could have a very significant impact on health capacity. I know that's an issue that jurisdictions around the world are looking at. Jason, would you like to comment further on the work being done?
Yeah, the work is ongoing. AHS is actually taking a look at what their protocols are going to be as they get a better understanding of what Omicron is, and then how long they would have to self-isolate and what the potential impacts could be on the healthcare system.
And Carrie, do you have a follow-up?
Yes, thank you. My second question is, in previous waves, you had asked Albertans to exercise personal responsibility before, and it really just didn't work. Why do you think it will work this time?
Well, actually, Carrie, I'm not sure I agree with you, because if you go back and look at the various waves in Alberta, you'll see that very typically, in retrospect, we hit the peak of infections prior to the most stringent measures being put in place. So what we've seen, I think, here and around the world is that it's widespread changes in people's behavior which has the greatest impact. Public health measures can help very much. They provide the parameters. They're the speed limit, if you will, that give parameters for people's conduct. But ultimately, as I've said many times, in a free society of 4.5 million people, where we do not and will not have a police officer on every street corner, we're going to depend on the good sense of people. I'll share with you again the example of the Oilers game at Rogers Place the other night. Apparently, 1/3 of the tickets they had sold were left unused. That was several days before this call for people to reduce social interaction. So that's something like several thousand people anyway who chose to stay at home that night. I've seen many anecdotal examples of that. And so, again, we could have the most stringent measures possible on paper, but if there isn't widespread population buy-in, the measures are not terribly effective. That's why we're giving people a very clear recommendation and a kind of urgent call to reduce the number of people they come into contact with by about half.
Thank you. Operator, can you please put through the next caller?
Chris Varco, Calgary Herald.
Hi, Dr. Hinshaw. Thousands of Albertans are going to be heading to the airport in the next couple of weeks to go and visit family and friends. What is your recommendation for people who were planning to fly over the holiday period, given the Omicron virus?
My recommendation to Albertans, whether they're planning to travel in province or out of province, is to minimize the number of close contacts you have. So I recognize this puts people in an agonizing situation. Christmas is less than a week away. And obviously, they're going to need to make the decision that's best for them. Again, I want to reiterate that the mental health toll this has is excruciating, and that there may be circumstances where that is the right thing to do, is to meet in person with people. At the same time, Omicron is spreading across the country, and the more people we're in contact with, whether that's by moving through airports, whether it's by being in settings in other provinces, or quite frankly in traveling across our province, not flying, the more chances there are to be exposed or to potentially expose others. So I think that's really important to take into consideration. And the final piece is to make sure that if you are traveling to another province, you know what the requirements are in those provinces. There are changing rules because the situation is changing so rapidly. So please make sure that you know exactly what the requirements are and follow the public health measures in whatever location you are in.
Do you have a follow-up, Chris?
Yeah, just for the Premier. Premier, are you still concerned with the federal travel advisory, which came out last week advising Canadians to avoid non-essential travel, just given the rapid rise in the Omicron cases in the past week in the country?
Well, I'm definitely concerned about the rapid rise of Omicron. The concern I raised was the notion was to respond to the notion that we could somehow prevent a widespread community transmission by limiting travel from abroad. I don't think that's realistic. As we know, this variant is here. It's spreading rapidly through community transmission, and so there's no keeping it out of the country any longer. I do think that people, as I totally agree with Dr. Hinshaw, that, you know, if you stay at home here in Alberta, but you go out every night with dozens of people to party it up, you're at much greater risk of transmission than if you simply make the decision, say, to travel somewhere to visit an elderly relative and absolutely minimize your social contact. So I think it means the context of the purpose of travel and how careful you are matters more than travel itself. Travel itself has proven to be generally quite safe in the COVID era with all of the protocols in place. Now the requirement that people be fully vaccinated, negative tests upon departure and upon return, masking, high-quality air filtration, et cetera. So I don't think the issue is the travel per se as much as it is what you end up doing, and you could be a far greater contributor to transmission staying in your own neighborhood, depending on what you do, than if you go and visit a relative somewhere outside the province.
Thank you, Premier. We have time for 3 more. Operator, can you please put through our next caller?
James Keller, Globe and Mail.
Hi there. A question for the Premier and for Dr. Hinshaw. I'm just wondering, in terms of the messaging today, we've got a situation where it's we could see the record-breaking COVID infections. If it's not less severe, as some people are hoping, we'll almost certainly see record-setting ICU admissions, which would, overwhelm the healthcare system if we were days away in the 4th wave. So I'm just wondering, how do people square that with an announcement today where the measures are more mild than we've seen in kind of any of the previous waves in terms of, when we hit the point where we needed to turn the ship around? I mean, certainly more mild than the 3rd and 4th wave. So how do you square those two realities?
Well,
and I'm hoping that the Premier and Dr. Hinshaw can answer.
James, you're just mistaken about that. What we've done is to add to the measures that we brought in September. So you take the stringency of the measures, which helped with the efforts of Albertans to get the 4th wave under control, and we've added significant additional measures here. But the single most important thing is that people step up and get the booster shot. I appreciate your concern, I truly do. But I believe that the greater concern is that only 16% of eligible Albertans have got their booster shot. So we know this thing is spreading fast. It will continue to spread fast. We know the single most powerful protection against infection and severe outcome is to get that 3rd shot. And if you're asking about where we may have the greatest vulnerability, I think it's in the relatively low uptake so far of booster shots. So that is what we are emphasizing. We are going to, as I say, move heaven and earth to make these as convenient as possible for people. This variant is going to move quickly through the population. There's one simple thing that people can do to protect themselves and the healthcare system, and that is to step forward to get that third shot. That is my urgent plea here today.
Dr. Hinshaw, do you have anything to add?
I would just reiterate that it is so critical to take this seriously right now. This is the time that we have to make a difference, and we must take Omicron seriously as a critical threat. I know that many people are very tired, and we would be tempted perhaps to see this as something that isn't posing a significant risk to our communities and our healthcare system. And I can't overstate the fact that we must take this seriously right now.
Thank you, Doctor. James, do you have a follow-up?
Yeah, a question for Dr. Hinshaw. During the fourth wave, the ICU admissions were quite high, and I think we heard the Premier say we were days away from implementing the triage protocol. Given what you've described, where we're going to see record for infections far and above what we've seen before, and if this thing isn't more mild, in a dramatic fashion, is there any way, just given our trajectory, that we won't hit that triage protocol?
We can't tell for sure what the future holds. I would say, though, that if we aren't able to alter the slope of the growth, and the only way to alter the trajectory of the growth is to, again, minimize the number of contacts that every one of us has in our daily lives, that the risk is that we do exceed that threshold. We don't know yet. We're watching to see what happens in other countries and other provinces. We don't know yet what that severity is. So it's impossible to say with certainty what that will look like. But what I believe is critical right now is that we take Omicron very seriously, that we see this as a significant threat, and that we collectively respond to it as such.
Thank you, Dr. Hinshaw. Operator, can you please put through our second last caller?
Adam Toy, Global.
Yeah, thanks for taking my question. Just wondering, a question for Dr. Hinshaw, wondering if we are aware of any of the early Omicron cases, if they have translated into hospitalizations yet.
I don't have specific data on the number of cases that have ended up needing hospital care. What I would reiterate, though, is that it is very early to be able to determine the severity. We know that typically rises in cases take a couple of weeks before we see a rise in hospitalizations. And even though the Omicron variant is spreading so rapidly, the rapid rise in cases, again, we wouldn't expect to see the impact on acute care immediately. That would take several weeks. The other thing that we know from watching our Delta wave is that when we saw a steep rise in cases, it actually took about a month before we saw a significant and steep rise in ICU admissions, partly because the initial rise in cases was predominantly in those who were younger, who by their age had a lower risk of severe outcomes. So it could take several weeks before we see any impact or significant impact in acute care, and we should not mistake that for reassurance that Omicron is definitely mild. Again, we must take action now, and it's really important that we take this seriously.
And do you have a follow-up?
Yes. Given the extremely rapid spread of the Omicron variant, are you considering requiring close contacts with COVID-positive patients to isolate?
The rapid rise of Omicron in all jurisdictions in this country has meant that we need to shift away from single case isolation protocols. So I would say that if someone knows they're a close contact of a COVID case, that they should exercise significant caution in the 2 weeks following their last exposure. We will not legally mandate quarantine. We will not be doing close contact notification, as I mentioned in my remarks. Like most other Canadian provinces, In fact, those that have had the significant spike in Omicron cases, we must direct our case investigation and contact tracing resources to where the risk is highest. So again, this is something that is common to all provinces, that people need to, first of all, limit their close contacts on a regular basis, because the way that Omicron is spreading, it's just not possible to be able to track every particular transmission episode. So it's important to first of all take caution in every activity that's done. And second, if somebody has any symptoms, it's critical that they stay home and away from others. And third, if someone knows they're a close contact of a case, we know that the incubation period seems to be shorter on average. So even within a day or two of having been exposed, that person could potentially be infectious to others. And it's critical that they, again, consider taking precautions, staying home wherever possible, because ultimately, again, if we don't take Omicron seriously right now, our window of opportunity will close.
Thank you, Dr. Hinshaw. Operator, can you please put through our final caller?
Adrienne Williams, CBC French.
Hi, my question is for Premier Kenney in French, please, but I'll ask my question in English so that everybody can understand. My question is, why not put in place or announce measures similar to those that have been implemented in or announced in other provinces like Quebec and Ontario that are much more strict? And so what's the government strategy with that?
Tout d'abord, nous avons en place les mesures rigoureuses depuis le début de septembre, le plus rigoureux au Canada jusqu'à cette semaine. Nous ajoutons les mesures importantes, mais le truc le plus important est pour les gens d'obtenir une troisième vaccination, parce que ça, c'est la meilleure façon de se protéger. Alors, c'est la raison pour laquelle aujourd'hui, nous élargissons les critères pour obtenir une troisième vaccination pour tout le monde de 18 ans plus s'ils ont reçu leur deuxième dose il y a 5 mois. Mais comme j'ai dit, le truc important avec l'épanouissement rapide de cette variante est pour les gens de limiter leur propre interaction avec les autres. Et en bout de ligne, c'est pour les Albertains de décider de le faire. Et nous avons ajouté les mesures importantes aujourd'hui. Si c'est nécessaire, dans les jours ou semaines à venir, que le gouvernement prend des autres mesures, nous le ferons.
Do you have a follow-up?
I think that answered my question.
Thank you.
Awesome. Thank you, everyone. That concludes the avail.